Hi, everyone. Welcome to another echo session of the DNO subcommunity of practice, which is co-hosted by ASLM and FIND. It's a pleasure to be with you all today. My name is Juhi Gautam. I work as the Senior Program Officer for the DNO program at FIND. I'm joined today by my colleague, Thomas Crompton, who is a GIS and data analytics expert. We've been working together on a couple of country analysis and some of our capacity building initiatives in the past. Just to give some context on the session for today, the aim of these echo sessions, for many of you who have joined us in the past, is to share technical knowledge and practical learnings in the use of diagnostic network optimization and related geospatial analysis for planning and strengthening diagnostic systems. And we do that from the ongoing work that is happening across organizations, across countries. In the previous sessions in this series, we have seen case studies from Kenya, from Zambia, and Cote d'Ivoire on how they have used advanced optimization analysis to help determine the best fit network design to meet their TB and HIV testing goals in an integrated manner, to inform their device procurement or placement, or to plan their sample referral systems. So there have been a range of applications for this kind of work that we have already seen in the past. As we went along with this work, we all felt a need to look at the more fundamental forms of GIS analysis and how they can help support some of the decision making. How can they respond to some of the initial questions that lab systems and disease program colleagues across these agencies face, such as population coverage or simply assessing the existing testing capacity before we even go on to optimize. And there is a need to kind of think about the more simpler GIS tools that may require maybe lesser data, can generate insights faster. So all of this to say that we will be focusing on some of this body of work in the coming sessions. In today's session, we will start off by introducing some basic concepts of GIS for diagnostic networks. We will go into different kinds of outputs and insights that these analyses can generate. And this should help you provide with some ideas on designing similar analysis if you're looking to do that and where to get started. Just to say that we also have a self-learning introductory course that will build on today's webinar and also some of the content that we will be covering in the coming sessions. So details will be shared at the end of this session. Please hold on. Please stay tuned for that. Before I hand over to Tom to go ahead with the presentation, I just wanted to leave a few housekeeping suggestions. Do drop in your queries in the chat during the presentation is on. We will try to respond to as many as we can during via the chat itself, and then also after the presentation is done. Also, if you have previously worked with GIS-based analysis and if you have ideas to contribute, please feel free to also drop that in the chat. This is the platform for that. With that, welcome again, everyone. I'll hand over to Tom. Please go ahead, Tom.
Cool. So yeah, as Julie gave me a great introduction today, we're going to be covering a few things. Previously, as she mentioned, you've probably seen how DNO and GIS analyses have been used in countries like Kenya and Zambia and Cote d'Ivoire, and what the results have been. But now we're really going to go back to first principles, and we're going to introduce some very basic GIS concepts. What is GIS? What can we do with GIS? And describe how different analyses we can do, and then show one or two examples of how it's been used in the African context. And so diagnostic networks, really we want to get, if we go back to the background of why we need this, we want the right amount of testing, of the right testing at the right time in the right place at an affordable and sustainable cost. And so how can we use GIS to help us achieve these kinds of things? We know that the current reality, diagnostic systems are very complex. There's a lot of things to consider, and patients often travel long distances and incur significant costs to access services. So that's the kind of background and framing for this presentation, but really we're going to be focusing on geographic information systems. So how can GIS help us with diagnostic network optimization, diagnostic network analysis, and most importantly, accessibility for our patients? And so GIS covers a wide range of things. In one of its simplest forms, it creates a map for you. But there's also some analysis that can happen. And to drive that analysis, you need data. There's data from satellites, from all sorts of different types of data. You can make kind of mobile apps with it if you think of an Uber or Google Maps kind of thing. And obviously there's many different careers. And so GIS is really taking data from a spreadsheet and spatializing it or giving it a spatial component and helping us understand how the spatial component affects all of our everyday life and the data we have in spreadsheets. In terms of diagnostic systems planning, we can use a combination of graphs and charts and maps to really help us understand our diagnostic networks. We can analyze the current footprint or network of a country and use this to identify gaps and opportunities, and also recommend the changes to the type, number, and location of diagnostics and associated sample referral systems. We can also use this to model the introduction of new diagnostic tools and approaches. So to begin with, we're going to talk about GIS visualizations. How can we visualize our data with a spatial component? And so to begin with, we need to understand what GIS data looks like. And so in its simplest form, GIS data starts with a spreadsheet. And an example in our use case might be the name of your laboratories. And before I get to the data, I must just mention that all of the data and the maps you'll see in this presentation is all dummy data. It doesn't reflect the real world in any way. This is found from openly available sources. So please don't read too much into the examples. It's all completely fictitious just for the purposes of this presentation. So with that said, data in its simplest form is the name of our facilities or laboratories, and then we need the location aspect. So that is the longitude and the latitude, otherwise known as the GPS coordinates. And that allows us to represent the spreadsheet information on a map. Then we can also have what we call attribute data. So that's additional data that we can add onto the spatial component that is attached to each laboratory or facility. So for example, we might have information of what is the capacity of the laboratory, or in the past, how many HIV or TB tests has it done, and what has been the utilization. So with this simple spreadsheet, I'm going to show you different types of maps we can make and what kind of questions we can answer with those different types of maps. And so to begin with, when we think about visualizations, the first piece of data is where are our labs. So just with the GPS coordinates, we can immediately take that spreadsheet or tabular data and put it onto a map. So as someone that's seen this for the first time, if they saw just the spreadsheet, they might have no idea where the labs are located across the country, but just putting it on a map, we have a quick and good understanding of where our laboratories are. And we can get a good idea of which areas have a high concentration of devices or a low concentration of devices. Then starting to use some of that attribute data, like capacity, for example, we can make the size of the bubble, so to speak, represent the capacity of the laboratory. So the bigger the bubble, the more capacity. And then we can start asking and interpreting the map in terms of understanding where in the country does most of our capacity lie to test for different diseases, where is there low capacity, and which laboratories have the highest capacity. Looking at a different type of attribute information, this is, for example, if we want to see the split by laboratory of HIV and TB. We might be able to do that in a spreadsheet just at a high level, but here we can do it for every single lab across a country. And so we can see which labs in this example test more for HIV or more for TB, and quickly get an understanding of where these samples are being referred to or being tested. The last one I'm going to show is utilization. So if we have data on utilization, we can also plot this on a map. And so in this example, red indicates low utilization. So a laboratory that is very underutilized and has lots of spare capacity. And purple indicates overutilized. So we may think about, oh, well, if a purple one is close to a red one, overutilized is close to underutilized. How can we start moving samples so that we move, instead of taking to an overutilized lab, we take it to an underutilized lab? And so just with these, adding in this attribute information, we're starting to see a picture of how the diagnostic system looks in the country. Moving on from just representing kind of point data on a map, GIS also takes a layered approach to data. So you can have many different layers of different types of data all on the same map. So in this example, we've got all sorts of different pieces of data that we all put in different layers, and that gives us a nice picture of what's happening in the real world. So how do we think about that in terms of our diagnostic network? So one example to start is what GIS calls a raster image, which is a fancy way of saying, let's take an area and break it up into grid squares. So lots of little squares all across our area of interest. And to each square, we're going to assign a piece of information. And in this example, we're using population. So for each square in the grid, we're going to assign a value based on how many people live in that area. So if it's 1 kilometer by 1 kilometer, let's say 10 people live in this square and 100 people live in this square. We get a good idea of where the population is distributed across an area. So in this example, all of our little grid cells, the lighter the color, so the more yellowy color, the more population we have. And we can see that's concentrated around Lilongwe in this example. And the darker the color, the less population, which would mean more rural areas. So that would be one layer of information. In our different layers, that might be our base layer of the population. Then we can go ahead and add our facilities on top of that. So that would be point locations. And so now we can start looking at where is our population spread, but where is our population spread in relation to our laboratories? Are our laboratories located close to where all the population is, or are they located far in rural areas? Or which areas of high population are not close to a laboratory? Then we can go one step further, add another layer, and we can add on the facilities. So now we can start seeing which populations are close to a facility, which populations are far from a facility, and which facilities are close or far from a laboratory. And so just by adding these 1, 2, 3 layers, we can start adding and interpreting and probing the answers to more questions by adding more layers. So I hope you're seeing how GIS we can use this layered approach to add on many different layers and start asking more and more questions just by purely visualizing the data. Now we're going to move from visualization to analysis. So how can we start using some GIS analysis techniques to improve our understanding of what's happening in the real world and improve our analysis? And these kinds of analyses can be done in a variety of different GIS software. There's free software like QGIS that can do this, or proprietary software like ArcGIS that can do this. And there are many others also available. So the first one we'll look at is a buffer. And a buffer is essentially, imagine drawing a ring around a laboratory of, let's say, 50 kilometers in this example. We want to know how far it is 50 kilometers around each of the laboratories. So if in our example here, this was our standard, we wanted facilities to be within 50 kilometers of a laboratory. When we previously just visualized this data, we would have to make a guess of, oh, that one looks close, that one looks far. Whereas using the GIS software, we can actually exactly quantify that. And we can say, oh, we know exactly which facilities are within 50 kilometers of a laboratory and which ones are far away. And so this is just one kind of analysis technique that can help us understand accessibility. As we know in many countries we work in, straight line distance is not always accurate. You can't always go 50 kilometers an hour or 100 kilometers an hour on a road. So GIS analysis helps us take that one step further and says, what does it look like in the real world based on travel times? So if I'm on a motorbike or a car, how long will it take me to drive from a laboratory to a facility. And this is what we call a travel time analysis. So we can say from my laboratory, show me how far I can drive in 15 minutes or in 30 minutes from this laboratory outwards. And then we can get an understanding of which facilities are within a 15-minute drive time or within 30 minutes or 60 we can specify. And this is more accurate than just a straight line because we know there can be rivers that we can't cross, there could be mountains, there could be valleys, and obviously we can't pass those easily. So road travel time gives us a better understanding of accessibility in an area. What we can also do is understand simply sample referrals. So if we have two laboratories, for example, in this example, which facilities should send samples to which laboratory based on the closest straight line distance. So if we just drew a line from A to B, which facilities should send to which laboratories? And so we can ask GIS to tell us for our whole country, tell me which facility should send to its closest laboratory, and then I'll get an understanding of my sample referral pathways. As we know, in the real world, straight line distance isn't always accurate. And so we can also use GIS to tell us, okay, no, wait, we want to include the road network. And how does the road network change? Maybe I have to go around because this bridge has been washed away, or maybe there's a mountain here, I can't go the straight line, I have to go to another one. So GIS will tell us the closest facility based on the road distance, so on a motorbike or a car. And that helps us understand these sample referrals. And this is an example, a small example for one district, but we can take this to the whole country. And once we have our sample referrals neatly mapped out, we can get an understanding of capacity that might be required at each laboratory. Moving on to device placement, and here we're going to get a little bit interactive in the next slide. So I want you to picture this example area where we have a whole bunch of health facilities, and we have 3 current laboratories. Now we've just got funding to locate 3 more laboratories, 3 more laboratories or 3 more devices. So we've got funding for these 3 devices, and we've said we want to place these 3 devices at an existing health facility. So I'm going to move to the next one. And we have identified 7 potential locations for this new device. So we've got our 3 existing laboratories in orange, and we've identified 7 potential sites where we could place these new devices. Now what we want to do is choose 3 facilities out of those 7 that will increase access to testing. So we want a good spread of facilities so that every facility is as close to its closest laboratory as possible. So what I want you to do is look at this map, look at the 3 existing hospital sites, look at the 7 potential candidate sites, the kind of green with the number on top, and I want you to place in the chat what your guess would be if you were to place these 3 new devices. Which 3 sites would you choose? So it could be number 1, 2, and 3, or it could be 4, 5, 6. So we're just going to pause here for a minute or two while you put your answers in the chat. And again, the question I want you to answer is, where would you place 3 new devices so that you could improve access to testing? And so your answer should be just 3 numbers based on which facilities you want to add these devices. I'm just going to pause here for a minute while we get some answers. On the next slide, I'm going to show you, you can check your answers, but what GIS can do is GIS can tell us which is the optimal locations based on the road network. So what it does is it matches each facility to its closest site, and then says, if we were to place 3, calculate all of the different combinations possible and place the 3 best devices so that access, the distance from each facility to each laboratory is minimized across all of them. So it does this huge big calculation, and it comes up and it says number 2, 3, and 7 in addition to our existing laboratories, would be the best place to place these new devices. So if you answered 237, fantastic. You did a great job. But I'm hoping what you can see here is this: when you look at the map visually, it's quite difficult to understand this, and this may be just one small subset. So GIS becomes super useful in calculating all these huge numbers for us and giving us the answer or recommending us an answer. Because this was just choosing 3 out of 7 potential options, but you can quickly see how if we were to choose 50 potential locations out of 1,000 different options, it would be almost impossible for us to choose. And so we asked the computer to run all these complicated analyses and provide us with some answers that we can then go and interpret. And again, with all of these, it's important to do this along with in-country experts to make sure that what the computer is suggesting is actually feasible and realistic in the real world. Now, let's say we've chosen some of these sites to place our devices. We can also use software to help us understand sample routes, so sample transport. So as an example here, we could say to the computer, I have a motorbike at each of my laboratories, and the driver works from 8 in the morning till 5 in the afternoon. Tell me how many facilities he can drive to in a day, assuming he has an hour break for lunch. And at each facility, it's going to take him maybe 15 minutes to run inside, grab the samples for that day, and jump back on his bike. So we can ask the computer to suggest what would be the optimal route for a driver to take and which facilities it would recommend. And then we'd also have an idea of which ones wouldn't be able to be covered, and maybe we need to do it on different days, or maybe we need to add more riders or more vehicles so that we can cover everyone. So GIS can be used for the sample transport as well. We're going to just quickly talk about some real world examples across kind of using GIS. And so the first one was done in Niger quite a few years ago, and this was purely accessibility. So here they wanted to look at how accessible is the population to primary healthcare. And so you'll see the more green the map, the closer it is to a primary healthcare facility. And using this kind of analysis, you can quickly see which areas are far from a facility and which areas are close, or where do we potentially need to place in a new health facility, or which areas are uncovered if we want to ensure equitable access across the country, which areas of population are struggling. And so this is really a data-driven approach to locating new primary healthcare facilities, but the same approach could be used for devices. In Lesotho, there was work done to optimize the TB referral network, and you can see how different facilities are referred to different laboratories to improve access to TB diagnosis. You can see that some might not make the most sense on the map when you look at it in terms of closest, but there might be a good reason for that in terms of capacity and utilization. But what it does do is give us an idea of the different number and placement of different devices. As I've been mentioning, there's kind of a stepwise approach to how you can do this kind of analytics based on the data you have. So if you start off with a simple set of data, you can look at just accessibility, how close or far are different facilities, and in relation to our population. Once you start adding more data, like your capacity and your utilization, you can then start understanding how device utilization is being used across your country, and also use that to infer around sample referrals. And once you get even more, if you start adding in historical referrals and costing data, you can really do some advanced analysis to understand exactly what the most cost-efficient system is across your whole country. And then going forward, with the necessary data availability, you can start tracking this in near real time. So you can track where my samples are going, how many tests each laboratory is doing each day, and what that looks like across my network. So in terms of start summarizing what we've looked at today, we've learned how we can visualize data with a spatial component. So taking spreadsheet data and translating that into a map, how we can use different layers of information on a map to understand more of the context and try and recreate what's happening in the real world. We can use different GIS tools to analyze and optimize the network to find the nearest and optimal locations for devices or for our sample referrals. We can answer different kinds of questions, like just purely by accessibility mapping, which areas do not have access to diagnostic testing, how accessible are these current services in relation to the population, and could we improve coverage with the introduction of new diagnostics. In terms of device placement, if we have new devices or existing devices, what does the computer suggest is the optimal place for these to improve accessibility? And does this agree with kind of what our in-country teams think is the most optimal? And we can use it for sample transport. So what's the best balance between adding more devices, or is it better for me to add a few motorbikes to increase sample collection? And what is the optimal route for specimen courier? So I hope that's been useful for you. As Juhi mentioned, there is a self-learning course that one can register for, which starts on the 5th of August. The registrations are open now. The course will cover some of this that we've discussed today. The slides will be shared, which will include the link. And if you have any questions, you can email the email address found there. So I thank everybody for the time and the opportunity. Thank you very much.
Thanks so much, Tom, for that comprehensive presentation. You covered quite a lot of ground, from the basics of what familiarizing our participants, our colleagues here, on what the basics of GIS might mean, but also how do we apply it in multiple settings. So excellent presentation. Thank you. We also have quite a few questions coming in. I can maybe start from the top of the list and we can go through all of them. Hopefully we will be able to get to all of them in the time that we have today. So starting off with, I think, Tom, you were talking about the layers and different layers of data that we can add on to a GIS analysis. So I think the question is, how many layers can you have without overcrowding? Would you want to take that one?
Sure. So that really depends on your context. It's kind of trial and error. You can have as many layers as you want, but again, your map will become kind of quite busy and difficult to interpret. So that's really up to you as the user. Depends on your end users and who's using it. So there is no real kind of rule, but you probably want to stay 3, 4, 5 layers to make sure that the map is easy to understand, especially if you're presenting it to other users. You want to make sure that your map is easy to understand and the message is clear. But there's no limitation in terms of the software and how many different layers you can add.
Right. Moving on to the next one, which is about the use of GIS and whether GIS can tell us where to use point-of-care testing approaches. So, for example, to screen remote populations. So I think the application will be, how can we use GIS in maybe advising the rollout or implementation of point-of-care testing? Tom, responses to that?
Sure. Yeah, it can definitely be used for that and depends on your unique use case. But again, speaking to similar concepts that we discussed, where are our facilities? If we were to place a near point-of-care device at this facility, how many people are nearby? How many tests can we expect to do? What does the prevalence look like in my area in terms of what disease I'm testing for? And that can give us an idea of, if I've got 10 options to choose for my near point-of-care site, which one is likely to get the most tests, so we make sure we utilize the device as much as possible and make sure our testing numbers stay high. So 100% GIS can be used for that, understanding accessibility, population, and capacity and utilization.
Moving on to the next one. So the question goes, in case a place is less populated, does it mean sample referral systems should be more strengthened rather than placing a testing laboratory? this is an interesting one, and I think it touches on a lot of the more advanced sort of analysis that have been discussed in the past. We have looked at how countries such as Zambia, Kenya, and Cote d'Ivoire, what the way they went about sort of looking at various parameters, not just access or not just distance to testing services, but then also comparing costs, comparing effective use of current testing facilities. It might make sense for the same problem if in some cases, if the area is less populated and they have a lab nearby, maybe setting up a sample referral or scaling up a sample referral mechanism makes more sense than placing a device. So just I was intrigued by this question, and I wanted to kind of share my thoughts before I pass it on to you, Tom. But yeah, I think this kind of a question requires bringing in multiple parameters, especially in the real world, where adding devices will incur a certain cost. Adding more, definitely setting up a new lab will definitely will not be an easy endeavor, even if we say that from an analytics point of view. Yes, that seems to be a response. So yeah, wanted to see, Tom, if there was anything else that you wanted to add to that response.
No, Gia, I think you've covered it. We didn't go into the in-depth kind of really complicated stuff on this one, but that's definitely a use case that can be solved with some of these more advanced software. That what is my trade-off between placing a new laboratory or increasing sample transport? And if we have the data and the costs associated with each, we can then start interrogating to see where it might make sense to do one or the other. And so it's very country specific. There's not one answer for both. It depends what the use case is and how many people, how rural is rural, how many tests is it expected to do, and what will be the scope of the testing. So short answer is, it's not easy to say one or the other, but GIS and software can definitely be used to help understand which would be better.
Thanks for that question. Moving on to the next one. We have two questions about data inputs, really. So the first one is, what is your definition of capacity, and what considerations, if any, do you make to arrive at the capacity estimation? Maybe you want to take that one, Tom, and then I can go on to the next one.
So capacity will depend on your device and what tests you're testing for. But usually the things that go into your capacity calculations are shifts, so how many hours in the day is the device being utilized? If it's 3 hours a day versus 24 hours a day, how many tests that device can run in an hour or in a day? How many days of the year that device is working? So it's really, what's my throughput of machine and how long is it operational for? If we can only do one test every 4 hours and it's only working for 8 hours a day, that's 2 tests a day. And if it only works Monday to Wednesday, that's not very many tests it can do. Whereas if it's a high throughput centralized machine that can do 100 tests an hour and is working 24 hours a day, that's obviously going to do way more. So those kinds of things will impact your capacity calculations, your HR, so shifts, number of working days per year, and then also your technical in terms of the device. What kind of device is it? How many tests can it do per hour, and for each kind of different disease you're testing for.
Right. All right. While I was looking for other questions in the chat, there are a few requests to post about the DNO course and the link for the registration. So I've just done that. There is a link that you will find along with the security code to register yourself. Please do that. The course itself will start on 5th of August, but you can register yourself in advance. In case there are any issues with accessing, there is an email ID that you can write to us at. I've also posted that in the chat. Maybe to provide a bit more context on the course itself. So this course is freely available. It will take approximately 10 to 12 learning hours. It's expected to do that. The course will be available and openly accessible throughout, but for the first 2 weeks from 5th August to 16th August, we are planning to have the course facilitators also join in and respond to your queries and basically be available for interaction around the course materials. Sorry, I think there is a pop-up on the screen, which we'll get to towards the end of this session. So yeah, please do refer to the link in the chat, and you can access the course there. Now I'll move on to the other questions that I see in the chat. It's great to see quite a few interesting ones, and it clearly shows that you've been thinking about this even outside this presentation. So thank you so much for sending in your queries. The next one is, do we assume that accessibility is equal for all? And again, I think this is quite interesting to see, because we do understand that accessibility varies according to different demographics. It can vary according to different subgroups in a country, according to various natural or geographical barriers. So it's not, I do not think that the assumption is that everybody residing within a geographical radius of, for example, 50 kilometers or 20 kilometers will have equal accessibility. That is a more nuanced analysis that one does need to go into. And just to say that you do have possibility in some of these GIS tools. For example, if we have data on population level data by age groups or by gender disaggregations, they usually mirror the population patterns. So it's not that you will probably get drastically different accessibility results, but with that filter of being able to locate different subgroups of populations, you can also check for accessibility by different population groups. So to the extent possible where that data is available, the point here is that we can try and dig deeper into differential accessibility for different groups. It can get a bit tricky, as we can imagine, but that's possible. So yeah, I just wanted to take that question, but Tom, if there's anything that you wanted to add on to that?
Yeah,
So
an
accessibility
example.
for different.
An example might be a kind of subgroup of your population. So if we're looking at pregnant women, for example, and the services they access, our analysis might be different in terms of which services they need to access, and that might not be all of our facilities, for example. And what is the population? Are there certain pockets of a country or an area of interest that have more people of this age, and where are they in relation to the services? So we can look at our analysis as a total population, but also as a subpopulation, whether it's an age, gender, or a disease prevalence. If we have higher disease prevalence in one area of the country, we may need to provide more services and more sample referral in that area than another one. So accessibility, yes, will vary depending on the question you're trying to answer.
Thanks for that. Moving on to the next one. I'll interpret this question according to how I understand it. The question really is there any relationship between population and accessibility? I'm assuming that this probably refers to the population density. So if it's a more densely populated area, we can assume that the number of people within a certain buffer zone will be higher. So in that sense, I do see that relationship. But yeah, I wanted to also bring you in, Tom, here, if you can respond to that, and probably from a different angle.
Sure. 100% what you're saying. We assume, and this is a big assumption in a lot of the analysis that we do, is that people will go to potentially their closest facility or a closer one. But we know sometimes in the real world, it might slightly be different, and that's a lot more difficult to model. So with things like stigma, and people have preferred health facilities that they want to go to, they might go to one a bit further, and we have seen that in the real world, or they work in a different location. But that is a lot more difficult to model and to use GIS to do. So a good first step is to assume that most people in general will go to one of their closer facilities.
I hope that at least partially covers the question, because I can see that there are lots of different ways in which we can interpret population characteristics and accessibility. Moving on to the next one, I think this is right. This is something that we are going to be talking about in our subsequent SubCop session as well. So the question goes, in terms of site level data used to inform geospatial analysis, what is the availability and quality of geo-referenced lab master facility lists at the national, regional, or the continental scales? Any tips on that, Tom?
Yeah, so that often, again, depends on your area or the country. Some countries are very advanced and have a lot of data available, whereas others do not have lots of data readily available. But the thing to always start with is your master facility list of where your facilities are, and then adding as much data onto that as you can, that attribute data that we spoke about. And so there are a few, if you're an analyst, kind of, so to speak, there are a few websites available online that do have lists of master facility lists that countries have published themselves, and that would be a good starting point if you are looking for data. I think some of them are things like Humanitarian Data Exchange has a whole lot of data on different countries around the world in terms of a lot of public health related data that has a spatial component. So if you're an analyst looking for data, I'd suggest starting there.
Thank you. Moving on to the next one. Now, this is about how applicable is the envisioned GIS compatibility with platforms or apps, for example, smartphones, for easy access to lab networks data. Yeah, I think this is a tricky one because most of our GIS tools I'm aware of do require, either a laptop along with some decent internet connectivity, but happy to take your inputs on this one, Tom.
Sure. So GIS software, there's many out there. In terms of one of the best ones that's free is QGIS. That's a really good one that's free and good to use. That you have to have a laptop to run most of it, and most GIS software you'll need a laptop. There are a few kind of online-based systems that you can use on your laptop. So there's ArcGIS, but that comes with a significant license fee. Unless you're a non-profit, then it's affordable. So that would be the kind of premium version. There are also kind of more open source ones like R or Python that can do a lot of this work, but then you need to have significant skills in terms of coding and an analyst that can do that. In terms of the mobile applications, those don't necessarily, it's a bit difficult to do all of this analysis on your phone, but what mobile applications are really good for is capturing data, especially in the field where the phones can work offline. So you can use offline capabilities and apps to capture data. For example, we did a project in Zambia where we drove to a bunch of facilities in the furthest reaches of the country, and we were able to use smartphones or tablets to capture data offline. And once we got back to an area with connectivity, we'd then sync all that data back to the main office. So smartphones, in terms of purely the analysis, is quite tricky at the moment, but they are excellent at capturing data, so capturing a Google form type thing and using that offline capability to then sync to the main database when you have the option.
Perfect. Now, moving on to, I think there are quite some ideas coming up around how do we use GIS and how do we use these sort of analysis in different contexts. So, for example, the next question asks us about what are the considerations to be focused on when working in a diverse geographic conditions, like having a highly populated city and remote hilly areas with less population, but challenges of transportation. So I see that we these different kind of questions that we ask, they change the way we design our analysis, but also how we interpret the results, because that's often the trickier part. The analysis will tell you some recommendations, but then making sure that they meet our practical constraints, that they make sense, that they help us overcome the challenges that our populations face in the setting that they are. I think that's something that remains a critical part of using the recommendations to create operational plans. So that is a part that we did not get to in today's session, but just focusing maybe on how these analysis, like what are the considerations we focus on when we work with GIS analysis in different populations and different settings. Tom, if you would want to speak to that.
Sure. So we talked a little bit about kind of accessibility with straight line distance versus road distance. And that obviously changes a lot whether you're in a city or a rural area. So things that one considers when doing in a city, if it's a big kind of metropolitan area, the thing one has to consider is traffic. I know in some of the countries we work in, traffic can really be crazy, and it can take you a long time to go a short distance. So if you were just using that straight line distance of saying, oh, it's only 2 kilometers, it shouldn't take me more than 5 minutes, but with traffic, it'll take a lot longer. There are some GIS software that can incorporate traffic. So like if you think about Google Maps, sometimes it'll tell you, oh, there's traffic here, go a different way. There are some software that can include that. And so that would be one way to think about it in a city. In a rural context, again, straight line distance, as we mentioned, if you've got hills or mountains or rivers or the road's been washed away, one needs more accurate and up-to-date information. And so making sure you investigate a lot of what the computer's suggesting, what the algorithms are suggesting. All of this analysis should kind of be done, but discussed with yourselves and your in-country colleagues to make sure it makes sense. I know in South Africa, we had one fun example where the computer said, no, well, we have to send the motorbike through this national park to collect samples. And when we discussed it with the in-country team, they said, no, the motorbikes can't go through the national parks because there's lions and elephants and things like that. So it's always best to be done with the country context and with the people that know the lay of the land the best, to work together with the computer and the professionals.
Thanks, Tom. And fun example there indeed. It's important to remember these, kind of contextualize these analysis in the real world. As much as we try to do that with inputs, there are limitations to analysis always. Perfect. So then I think there are a couple of questions more before we will move towards wrapping up the session. I think there is one around, there's a request to conduct a session where we demonstrate how GIS is used to optimize the diagnostic network. I think we do have a couple of examples already from our previous sessions. So in these analyses, we looked at both, not just access. So we moved beyond visualizing and mapping physical access to services or testing capacity. But these analyses also looked at comparing costs, comparing access benefits, and then also comparing how efficiently we are using existing capacity, and they tried to come up with sort of optimal solutions to, for example, reduce turnaround times for HIV testing, or to implement integrated TB HIV testing and other multi-disease testing. So there are quite a few of these examples available, and I can post some links in the chat. There are from the previous LabCoP sessions as well, and also some publications that might be useful to refer to. Are there any other, Tom, can you think of any other examples or something that you would want to speak to this question, basically how GIS is used to optimize the network?
No, just to say that, yeah, you can get quite kind of fancy and complicated with your optimization in GIS networks. So there's different ways you can optimize. You can optimize for cost, you can optimize for access, and you can optimize for a few different things. You also can optimize by considering capacity or not considering capacity. So there's a few different things one can think about. And again, depends on your use case and what question you're trying to answer. So the computer is very good at it, but you need to know what to be able to tell the computer that you want to solve when optimizing. And it can get quite complicated as you add more variables and things to consider.
Thank you. I see, yeah, the next question you've responded to already. This is about which softwares are open and which are pay per use. So yes, so QGIS is free, ArcGIS is paid, and R or Python is free, but it requires coding skills. So as you can see, there are different softwares with different factors to be considered when we are deciding what softwares, which software best meets our requirement. So what are its capabilities? Are there any additional costs? What technical skills are required to use it? So there are lots of these factors. There is a landscape report that Fine and some of our colleagues, including Tom, we worked on to try and summarize the commonly used softwares. That is by no means an exhaustive list. There is a lot more out there, but the most commonly used ones, we've summarized that. I can also, you will find a link to that report on the Find webpage. I think it's also there on the LabCoP webpage as well. So I'll just leave a link to the reports there for everybody to access. So yeah, that can be a good starting point if you would want to start looking at what kind of softwares can do, perform what sort of analysis. All right, I think that's pretty much the end of the list, unless I'm missing something. And I also see that there is a link for the certificate of attendance for this session. So please watch out for that. Great. So unless there are any other last minute questions, please feel free also to write to us after the session if there is something that you would want to know more about. And please do also join us for the DNO self-learning course. The link has already been shared with you in the chat. We look forward to seeing many of you there. With that, I thank you all for joining. We had a really interesting and interactive session. That is something I really look forward to every time I come back to the LabCoP sessions. You all bring in so much insights and interest. I think that's really good to see. Great. I'm just checking the chat. I see that there are some other links coming in. With that, I would like to wrap up the session today. Thank you so much, Tom. Thanks so much to the ASLM team for organizing this and for having us present on this important topic. And we'll be back very soon with the next one in the series. Have a good rest of the day, everybody. Thank you.
Thank you, everybody.